Okay. Hello everyone. I would like to thank you all for joining us today. Again, this is our second live session of October theme, which is based on neuroscience and psychology. And today we have Professor Jonathan Green with us for a live talk on autism. So for those who are new to our platform, I would like to provide information about the structure of our live talks. So basically we will start with a talk where Professor Green will be telling us about autism and his research, and then we will have a 10-minute comfort break and we'll resume for a question and answer session afterwards. So during the break, please make sure you release or you actually write your questions to the chat section, or you reach to us through our social media channels. I will be collating all of these questions during the break, and we'll be asking these to Professor Green. So if you have got any follow-up questions as well, please feel free to add these, because I will be monitoring all of these platforms as we're having the Q&A session. So before moving on to our discussion, I would like to briefly introduce Professor Green. So Professor Green is a Professor of Child and Adolescent Psychiatry in the University of Manchester, and he is also an Honorary Consultant in the same field in Royal Manchester Children's Hospital, and also he's part of the Manchester Biomedical Research Centre. He's a clinician scientist. He's a clinical scientist, and his focus is on early development and autism interventions, and he specifically have been focusing on parent-mediated early intervention. So he's been, especially as far as I'm aware, especially recently, he has been widely involved with international studies, and he has been involved with collaborating with different trials of parent-mediated therapy in infancy and early childhood. So Jonathan, thank you for joining us today. It's an absolute pleasure to have you with us, and we're all looking forward to hear about your research in autism.
Thank you very much, Aisha. It's a pleasure to be with you all this evening to talk about this subject dear to my heart. I guess that some of you, well, you're all interested in autism, otherwise you wouldn't be on the lecture tonight, but you may have variable understanding of the condition. So we'll talk a little about that, and then about what I have worked on as what I've called an integrated early intervention system for children with the condition. So what's autism? Well, I'm sure you probably all have a reasonable idea of this, but it is a wide spectrum of difficulties which can profoundly affect a child's early social communication development, and also impacts on their early way they organize their own behavior. So what we call restricted and repetitive behavioral patterns that are often seen as the child gets a little older. This is a neurodevelopmental condition. In other words, it's largely the result of genetic variation in the child, which probably starts to express itself before birth. The actual pattern of autism in development that we see is really based on what we see in the child's behavior, and this emerges early in development by about 2 to 3 years. And one of the characteristics of it is that once this pattern of autism has emerged, it's pretty enduring. So this tends to persist through childhood and adolescence, and in most cases through the lifespan. So this is a long-term condition. And the way we take a developmental approach to autism is we try and identify what are the early developmental processes that are going on in these early years that might be leading to later difficulties. And we have an understanding that there are these early developmental difficulties that have a sort of cascading effect over time as the child grows and interacts with their environment. both their human environment and their physical environment. And it's those cascading effects that actually are responsible for many of the consequent difficulties and mental health challenges for families and individuals that we know are there for children with this condition as they get older. So the approach to intervention that I and many others have taken around the world is to say, let's try and intervene early on in the development of the condition to see if we can somehow ameliorate this cascade of effects and make life easier and better for children with this condition. We also need, as clinicians, to work towards an integrated care service to support families looking after these children. And that's no mean feat, and I'll come to that at the end of the talk. So what I'm going to talk about this evening is our approach to what we call parent-mediated intervention, and I'll explain what that is. And I'm going to describe how this applies to both intervention very early, before the symptoms actually become consolidated into autism, and I'll explain how we do that in infancy for children, for infants who are at risk of developing autism. And then I'll go on to talk about our intervention that we've developed for children after diagnosis, preschool. And finally, talk about how these can be integrated into a pattern of overall evidenced care. So what is parent-mediated intervention? Well, essentially, it's an intervention that is focused on the family and particularly on parents. And in this kind of intervention, we actually work with parents rather than directly with the child. It's an intervention, therefore, delivered with and through parents to enhance the social development of the neurologically vulnerable child. And our idea is to work with parents and through that, as we'll see, to make changes in the child's own experience of development and developmental progress. And we hope that that will have positive cascading effects as they get older. What's special about this kind of intervention? Well, it works and it's intended to work within the natural environment of the family. This is where children grow up, of course, naturally. It's the context for early social, language, and other skills development in our culture. We know that the early development of these skills for any child is highly influenced by these early experiences and interactions in the family. The fact that we work at this level with parents does not mean that we're saying that there's anything wrong with the parents, not at all. The parents are absolutely fine. Usually what they're faced with is the challenge of having a child with autism and needing to understand them and do the best they can and be the parent they want to be with this child. And having a child with autism for many parents is a perplexing business. They want to be great parents, but reading and understanding the child's signals, communication, and needs can be challenging, and that's what we want to help them with. The spin-off from working like this is that we can empower parents to be the parents they want to be confident about that, not to be de-skilled, as lots of parents feel in this situation, and to improve family function atmosphere. It's efficient of professional time, because once we've really helped families and parents to do this, then it's a 24/7 therapy, if you like, because the kid is with the parents in the family the whole time. So we hope that that really will help embed this into developmental processes. This is, although sounds fairly straightforward, is actually quite a demanding therapy. It is not at all just a bit of education or coaching or let alone tea and sympathy or support for families. It's quite a specific work that we do with parents using video feedback techniques to help them really understand the details of their child's communication and how to respond. And we know that video feedback learning is a very effective way of helping adults learn and understand new skills. So that's why we use it. Here's an example of the sort of way that the core of the therapy sessions go in this sort of work. We start off by having a period of interaction, videotaped interaction between the parent and their child. And I'm just going to play this. And then what happens is that the parent in the question here watches back the video along with the therapist. You'll see how this works.
Exciting. Stop. Yes. Together. Push. Stop. Nathan, stop. Play Pico. Pico. Where's he gone? You found me. You're so clever. Clap hands.
So for those of you who might not have seen a child with autism on video before, you'll notice, I'm sure, a number of things that would be a bit different to what you might expect from what we call a neurotypical child, a regular child of this age. Firstly, he's not speaking, he's not got language, and you'll see that a lot of his social interactions are slightly different to what you might expect with most children. So here's mum trying to work out how to be with him given that situation. And here she is with the therapist looking back at that particular bit of video.
Yes, the one where he understands Nathan. Yeah, and he got quite excited when I stopped it. Yes, the first time you stopped it. I think that was right at the very beginning, and that's something that's really quite interactive because I think he realised I did that, and it made the game more fun. Yeah.
Well, let's watch that bit again and see. Yeah, just see what it is. Let's have a think about what made it interactive. What were you doing? What was he doing? What signals was he giving you?
Yeah.
So that
that's what I need to read.
This means he wants me to be in this bit.
Yeah.
Yeah. Let's see what he does.
So you'll see what the therapist is doing here is working with the parent, watching the video with them, and it's the parent who's really discovering things in this video with the therapist's help. And it's that kind of co-working with the sort of co-exploring, co-learning together with the therapist aiding the parent that is the key to how we work here. The parent, through the video, discovers their child in a way that's more difficult to do when you're with the child or anyone in real time. So that kind of interaction is the core of the work we do in the therapy. And I'm going to talk about a bit about a therapy that we developed using this kind of technique for babies. And these are babies who are at higher risk than normal of developing autism. And the reason for that is that they are the siblings of a child who already has autism. So because autism is quite heritable, if you are the sibling of a child with autism, a newborn sibling, you're going to have a higher than expected likelihood of developing the condition yourself. And so what we do is we take these babies who are at higher likelihood of developing the condition, and we work with them a long time before the autism behaviors may actually become apparent. So this is a really what you might call a prevention intervention to see if we can work with the babies very early on to head off difficulties. It's home-based, 12 sessions, as you'll see, over 5 months, a daily practice plan for parents, and we run through a number of themes of early child development with the parent, working with them using video feedback to help them respond optimally to the baby. And here's a sort of before and after example of what we're hoping to achieve between the mum and the child in this instance. So here's a before. The child's around 7 or 8 months of age.
Wow. That tastes nice, doesn't it?
The mum's working very hard to engage the baby here. Baby seems quite passive and not terribly engaged in the objects. And here is after the therapy. Obviously, the baby is a few months older, but this is the sort of thing that we're hoping to see a few months later.
Yeah.
So you see here, mum is doing things that you'd expect from pretty much any mum or dad and young baby, engaging them, having fun together, playing peekaboo. But with these children who are at high likelihood of developing autism, it's more difficult to get this kind of interaction going with this shared enjoyment. And it's this kind of shared enjoyment in the interaction that is the environment, the place, the context where children learn social skills. And it's this kind of interaction that we're aiming to promote in these at-risk babies. So we've done a lot of work on this infancy intervention, and we've published clinical trials testing out whether it works or not, published them. And what I want to do is show you the results of these along this kind of format, so that, as you'll see, what we're trying to do is change or help the parent get sensitized to the child's communication to them, change in their behavior, get more responsive to those subtle interactions, which are really can be quite subtle in children with autism or pre-autism. We're then hoping that through that parental change, the infants or children will start to interact more with the parent themselves, initiate more interactions. That's what we expect from developmental theory. And then the key step is that we are hoping that increased interaction with the parent will translate out, generalize out into the way that the child interacts with other people in their everyday life outside the family. That's the key change that we're looking for. So it's those three steps that we're after. And here is the results of the trial of this therapy that we did with young babies in the first year of life. So I'll just show you how this graph works. So this is along this axis here is time, months from the start of therapy. This is the point, this dotted line is when the therapy ended. And then all this period is the time that went by after the end of therapy. So what we do here is we don't just look at what happened immediately after the therapy finished. We're interested in what happens downstream in development. Because if this therapy's worked, it should have a kind of cascading positive effect. That's what we're hoping for. So this is the parental change we're after, which we measure using video coding ourselves, and we just measure the parental behaviors. And what we're looking for here, this line is the group that we had in the intervention compared to the group who didn't have the intervention, who are along this dotted line here. And what we're seeing here is that there is a big effect of this video feedback intervention on improving, from our perspective, the parent's understanding and responsiveness, what we call synchronous responsiveness to the child's communication. And what you'll see is that that improvement, which is represented in the difference between these two lines, continues right the way through for the next year. And then it seems to fall off for a bit. So it seems to wash out, as we say. Then we're interested in what happens to the baby. So here's the baby's social responses to the parent. And you'll see that this seems also to improve, but slower. So there's a lag effect, as we say. But what you will see is that in the year and 2 years following the intervention, that improvement in the child's social initiations with the parent sustains, and in fact, it seems to increase over time. And so overall, when we look at this effect over time, it's highly significant. So we get a treatment effect in the sense that the child's behavior has shifted in a sustained way over time through development. And then the final step, as you'll remember, is whether we see this change outside interaction with the parent. In other words, whether the child has generalized this change into other areas. And this is the key measure of autism symptoms. And here the line goes down because this is about severity of symptoms, severity of abnormality. And we measure it using standard tests with a researcher. And what you'll see here is that the severity of the abnormal, if you like, autistic behaviors that the researcher sees at the end of therapy has gone down compared to the beginning. And that decrease is sustained through the next couple of years. It seems then to tail off a bit, perhaps at the end. But basically, you've got a cumulative effect over time of reduced unusualness in early behavioral presentation, which suggests to us that we have improved autism or the beginnings of autism symptoms using this kind of approach. So that's what we did with babies before they were diagnosed. And not all of those babies actually would have gone on to be diagnosed, but we seem to have improved their social functioning in all of them, actually. Then the more substantive work that we've done, which is similar in its nature, is with children from about 2 to 5 years after diagnosis. So this is children who are actually diagnosed with autism, have developed and presenting with the condition. But the basic principles of the therapy are the same. It's a longer program, a year's program in this case, but the video feedback and the way it's sequenced in development is pretty similar. And we're in the same way aiming first to change the parents' responses, then we're waiting and looking for children's reactions to that, and then to see if those reactions generalize out into everyday life. So this was a much bigger trial, much bigger clinical experiment, if you like, that we did to test the effectiveness of this intervention. This is one of the largest intervention trials that's ever been done in autism, as it happens, for 152 children. And they're randomly allocated, is what's called a randomized trial, into ordinary care or ordinary care plus this, what we call the PACT treatment, this communication therapy. And these are children with quite severe autism. So we purposefully chose children like this because they are the most important, if you like, clinical challenge that we have clinically. So we wanted to tackle that rather than less severely affected cases. Time is going across here, and basically the therapy lasted for about a year. And then we followed the families up until the children were about 10 and a half. So it was about 6 years after the end of therapy that we followed them up. So we are finding out how they did during therapy and then for 6 years afterwards, which is a long period, but we managed to get 80% follow-up of the families from the beginning to when they were 10 and a half. So that's a pretty good follow-up rate, we felt. So I'm going to present you the results. These were published in the medical journal called The Lancet in 2 publications a few years ago. And I'm going to present you the results in the same kind of way as I did for the graphs before. So here's time going along the bottom. This is the therapy period. In this trial, we took a measurement at midpoint of the therapy. That's the end point of therapy. And then there's this long period that goes by before we did the follow-up. And in this case, we've got the normal care and then the PACT, this R therapy that we were testing is in red. And what you'll see here, this is the effect of the therapy on the parent's behavior. And you'll see, just like with the first set of graphs I showed you, that the therapy has a very big effect on the parental behaviors. In other words, parents are really good at using the video feedback to pick these kinds of skills up. And we find that this is true across all sorts of parent groups that we've tested over time, all sorts of demographics, socioeconomic class, ethnicity, cultural groups. We've done this same work in India, and you get a same effect in Indian mums and dads as well. Everyone's pretty good at learning this using the video. And then you'll see that what seems to happen over time is that this group catch up. In other words, there's no difference over this by the time we follow them up at 10.5. Although this difference between the lines still actually happens to be significant over time. But that's the parental effect is strong in therapy. Then we come on to the child's behavior with the parent. And this, you'll remember, started off a bit slower, and that's the case here as well. So you get a bit of a treatment effect from the PACT treatment, but it's not as massive as with the parents. But what you do see here is the treatment effect that we get, which is significant here, continues right the way through for 6 years. So there's no difference over time between this finding and this finding. And the assessments here are done in the same way as here. So the people who are looking here don't know which group whether the parents were or the families were in the treatment group or the non-treatment group. And so this randomized trial is a good test of the effect of treatment over this period. So we seem to have a sustained effect on the child's social behavior with the parents. It doesn't drift away. And then the key bit, as I mentioned before, is the symptom severity. So this is whether the child shows reduced autism symptom severity when measured outside the parent context with a researcher. And here you'll see, similarly actually to the last graph in the last study, is that we get reduced severity compared to normal treatment in the PAC group. And that this at the end of therapy, and this reduced severity again continues unchanged right the way through. So we get a sustained effect, which doesn't seem to wash away, even though the child during this 6-year period is not getting any more of the PAC treatment. So it seems to have had an effect in development that is sustained. This just makes the point that the shape of these two graphs from the infancy trial and the preschool trial I've just showed you are remarkably similar over time, although the actual time length's a bit different, but the shape of it is rather similar, which we find very interesting. So we have a sustained effect on autism symptom severity, and this is the first time actually in autism that any treatment has shown an effect like this. So this is an important milestone in autism treatment science results, that we've got a treatment that seems to be able to have this sustained effect. So in summary, from this work that we've done over a number of years now, we have a 5-month infancy intervention, which I'll talk to you first, which reduces the symptom severity of these early, what we call prodromal symptoms, not fully formed, but we can still reduce their severity during the period to 3 years. That's in the early period. And then we've got this 12-month intervention that reduces the severity over 6 years following treatment. And that's is an important result. It affects both the social and the repetitive behavior domains of autism symptoms. This is social communication, and this is what I called at the beginning, the repetitive behavior aspects. Both of those are improved by this kind of therapy, which is also supported by parent ratings who agree with the researcher ratings that I base the graphs on, and also to some extent the teachers. That's slightly weaker. So that's the result of the work that we've done. One thing that doesn't change so much is what we call formal language, which is, for instance, the number of words the child says. This therapy doesn't seem to alter that so much compared to normal treatment. But what it does do is it improves the way that the child uses the words that they have, and that's the key issue in autism. So it's the social use of language, the social communication is the thing that's improved. We're not saying this is a magical cure. These children are still autistic, but their level of handicap and disability is less. So this kind of intervention focused on families, aimed to help families adjust and be responsive to their child's communication, is what we think is the key early step that we need to do with children who are diagnosed or at risk of developing autism. If we're going to put this into a health system in an integrated way, we need to have a health system that can put interventions like this in a consistent and sustained way over time. What do we need? We need integrated detection and response. So we need to find children early who have the condition so that we can intervene. And we need online registration, family inclusion, symptom monitoring, and case management. All these things need to be there because this is a long-term condition. And we also need specialist step-up services within autism teams in an area to respond to other difficulties that the child may present with as they get older, which they may well do, and which may require different kinds of help. So in summary, my last slide, this is to show you in summary how we approach the integrated care of autism through development using this kind of model. So you've got, here is age going down the screen. We've got the prodrome, what we call the prodrome. This is the period of time when children are developing, but before they actually show their autism symptoms. But we know that a lot is going on, which is disrupting their development during that time, even though we can't see it. So that's the prodromal period. Then we have the diagnostic point, which is anywhere around 2, 3, 4, 5 years or so. Then we need to respond to that, these what I've called core symptoms of autism. And this is what I've talked about today in terms of this IBASIS trial, which is the baby, and the PACT, which is the preschoolers. This is family-focused, developing family resilience, improving child function, maximizing adaptation. Then later, children with autism in the school years can develop other conditions, anxiety, sleep problems, difficult behaviors, depression, obsessive compulsive difficulties. All these are more common in children with autism, and they need their own therapies, not PACT and IBASIS, something different. And here we need to have a responsive system that picks these conditions up when they occur. They don't occur in everyone, but picks them up and gives them timely treatment. So if you have a sequence like this, I would maintain, given a health service that can support it, we will have the best enduring developmental care for children with autism. So that's what I wanted to say. Happy to have a conversation and answer your questions. These are just to thank my wonderful colleagues around the UK who worked with me on all this work. This is the group in Manchester and London who worked on the baby study. And this is the group who worked with me in Manchester, Newcastle, and London on the PACT study. You'll see lots of people there who worked together on it. So I'd like to thank you very much. Here's some links to more information if you're interested. There's lots of further detail on both these therapies that you can find on those websites, or you can get in touch with me on that email address. Thank you very much.
Lovely. Thanks a lot for this interesting talk. So we're going to give a break now for 10 minutes and we will resume back for the questions. Okay, great, thank you. So I'm gonna ask one of the audience questions. So is there any evidence to suggest that these improvements in communication extend into other family relationships or friendships at all?
What we have shown in this study is that they extend to how the child interacts and communicates with the researcher. So this is an independent person who, if you like, is representative of anyone the child might meet in their everyday life, a new teacher or another adult of some sort. So we know that the child's communication with the researcher improved. That's the basis on which I was talking about the symptom change, because it's measured by that researcher. Will it affect relationships and other aspects of the child's life? Well, yes, we do have some evidence of that as well. So I wasn't able, obviously, to go into all the details of everything we measured, but the parents gave us a measure of the child's, the family atmosphere, how the family was functioning at the end of the treatment. So we wanted to try and get hold of something about that. Were there effects on family life? And the answer was yes. The parents in the PACT therapy did say that family life had improved and that they were very happy with that. That includes relationships with peers and with siblings. But, we haven't tested that in a huge amount of detail. So we haven't gone in and particularly looked at peer relationships in school, for instance. I'd imagine that they would have improved. And the teacher ratings that we have do include an aspect of how the child gets on with peers. So I think the answer is that it's most likely to be the case, yes, that they would have done to some degree.
Okay, thank you. So obviously you're observing some changes with these children. So what do you think are the psychological or biological changes that are actually happening in these children that is manifesting itself with improvements in behavior?
Well, that's a great question. The answer to that is that what we know from the more detailed, I didn't present this evening, but the more detailed analyses that we've done of all the information that we get from the trial is that it is that change in the parental responses that is responsible for the improvements in the child. It's what we call a mediation analysis. So we know that was the thing that made the difference. Why should that have made the difference? Well, from decades, years of child developmental science, we know that these kinds of processes do have a profound effect on child social development and language in the range of child development, so what we call neurotypical child development. What we've done in this trial, which is a real change, a bit of a paradigm shift, is to say, if this is true for regular kids, why can't it also be true with children with autism? And what we've shown is that children with autism respond to these kinds of psychological interactions and relationships in the same way as children with who don't have autism. In other words, they don't march to a different drummer. They basically are following the same kind of rules of development, except in their own kind of way. So we think that what the intervention does is it sets up a positive cascade effect that is self-sustaining over time psychologically. So that's one explanation of what happens. And because it's happening in the family, it's embedded in family life, and it sustains itself because of that. So unlike a therapist who comes and does great work and then goes, here the parent doesn't go away, they're there all the time. So that's sustaining it. Whether there are effects on the brain development of the children is also an interesting question. So sometimes when you have these improved interaction experiences, it actually makes a difference to your brain function, which then can be part of the ongoing improvements. And we do have some evidence that may be the case. We have from our own work and other people's work that this kind of change can affect brain functioning. And so it's possible, we can't be sure, but it's possible we've made some subtle changes in the child's brain function during this therapy that has helped sustain it through development. So that's possible as well.
Okay, great, thank you. So one of our audience is asking, with this approach though, how do you motivate parents? Obviously, it's not going to be just easy to get used to a new way of interacting with the child, and it might be really hard, and people might be disheartened by not seeing a huge improvement in short amount of time. So how do you handle those kind of parents, and what kind of strategies do you actually use to overcome that a loss of motivation or resistance from the parents?
Yeah, it's a great question. I mean, I would say that the prime motivator is a sense of connectedness. So one thing all parents value above all is that wonderful sense of connectedness with your child. So anyone who's been a parent knows what it's like when the child first smiles at you, that magical moment. It's like, bang, light bulb. It's so bonding and it's so reinforcing to parents. What helps parents get up at night and go through all the hassles and work that being a parent involves. And one of the things that parents of a child with autism often miss out on is some of those social reinforcers, some of those social feedback from the baby and then the child that really is so rewarding. And one of the early things that happens in this therapy is that the parent starts to get those social feedbacks from the child. And we call that a kind of light bulb moment. It can take a few sessions, but when it happens, it's so motivating. And the sort of personal feedback that we have from parents kind of really reinforces that, and talk about sort of light bulb moments. So they talk about, I suddenly felt this connection with my child that I hadn't felt before. Mm-hmm. And really, once a parent feels that, it's hugely motivating for them to continue. I mean, like with anything, it doesn't work for everyone. And some parents, don't find this. And you're right that it takes a bit of time for this to work. Some parents want to do something to the kid to make a change. And to intensive education or something like this. This is a slower and a slightly gentler, if you like, form of work. You do need a bit of patience, but as soon as you get that reinforcement, it's massively massively reinforces the connectedness, and then the parents will carry on doing it for sure. So there are some parents for whom that it takes a bit longer, and that's the job of the therapist, is really to keep encouraging them and to keep helping them and pointing out the good things. And most parents, it works well.
Okay, great. Thank you very much. So one of the last questions that I would like to ask, if it's still okay, is do you think this might become a service or an approach that's available from NHS? And if that is so, and if anyone who is watching this is interested in taking part, what they should be doing in order to either get involved, to try this out, or find out when or where this would be available in the NHS.
Yeah, well, certainly we want this kind of approach to be available in the NHS. It is available in the NHS, but its availability is patchy. So there are a lot of therapists around the country who are trained in this approach, and there are many areas where this approach is used. So, but it is patchy, and what our aim is to get it implemented more consistently across. So there isn't a sort of postcode lottery. In Greater Manchester, for instance, we have a big program ongoing at the moment to redesign services for children with autism, to include this kind of approach in the way I've suggested right at the beginning as the foundational therapy. That's supported by the Greater Manchester Health and Care Partnership and the commissioners, etc. They're very enthusiastic about this. And what we're working to do over time, within all the resource constraints and everything else that everyone knows about in the NHS, is to embed this in. So we have a big training program for practitioners. And on the last slide I showed you before the break, there was some contact information there about how practitioners can be trained. And if any parents who are watching or other people involved with autism who'd like to get involved to help us promote this kind of work, we'd be delighted. And we do have actually a big parent body who are working with us within our organization called Impact to help promote the therapy. So for anyone listening, if they've got the that final slide, just drop me an email and I'd be very happy to put you on to the relevant people. And there are a lot of parents who are involved, and we need you. Together we can do this in a much stronger way. Parents have a great voice. So yes, it is a real ambition to do that. And autism needs this kind of consistent service level approach. There are other interventions. This isn't the only thing, but there are other interventions that can be involved as well. But it does need this investment and consistent application. And that's my ambition. Our ambition is to provide that within the health service. Exactly.
Lovely. Thank you very much for your time. And I think this is the end of the questions that we had from the audience. And it has been a really interesting talk. Thank you very much for your time.
Okay, it's a pleasure to have been with you. Hope it's been helpful and interesting.
Yes, it definitely has been, and you can tell from the number of questions that we have received as well.
Okay, well, great.
All right, thank you.
Bye-bye.
Bye-bye.